The once I had a friend, Dr. Amit Sen Gupta, a gynecologist. He was just one sec. And he once mentioned that, the most beautiful organs of a woman's body, by the end of, the age, they become her enemies. So one must be aware about our body. It's always said, दुख और तकलीफ बोलकर नहीं आती, दुख और बीमारी बोलकर नहीं आती, लेकिन मैं ये समझती हूँ कि हल्की दस्तक तो देती है। क्या हम उस दस्तक का इंतजार करें? क्या हम इंतजार करें कि बीमारी दस्तक देगी और तब हम खड़े हो जाएंगे और दवा ढूंढने लगेंगे? या क्या हम पहले से ही पहल करेंगे, शुरुआत करेंगे और आगे बढ़ेंगे और सतर्क हो जाएंगे? तो बच्चों को सतर्क करना, making them aware, is the basic goal and the objective of the session that we are going to have today. So I've also invited my teaching fraternity friends from school, junior college, or international school. So on this behalf, I, warmly welcome my fellow colleagues from the teaching fraternity and all the heads of the institutions who are present in this session, and members of the management who are always there to support us and not coming between the students and the doctors. I, welcome Dr. Hitesh on this platform. Thank you, sir, for being with us. Yeah.
Thank you, ma'am. Now I would like to invite our today's resource person, Dr. Uma Dangi and Dr. Hitesh Singhvi. Dr. Hitesh Singhvi is a consultant of head and neck oncology and currently working at Fortis Hospital of Mulund. He is trained at Tata Memorial Hospital, Mumbai.
I will request students to mute their microphones or the host. Kindly do that. Hello. Kindly mute the microphones.
Yeah, ma'am. He is trained at Tata Memorial Hospital, Mumbai, in head and neck oncology department. He has keen interest in treating cancer patients and cancer research with a special interest in preventive oncology. Dr. Uma Dangi is currently working at Fortis Hospital of Mulund. She is a senior consultant medical oncologist. She is a medical oncologist trained in India. She did her MBBS from Grant Medical College and NDNB Medicine from Cooper Hospital. She went on to complete her medical oncology training from Hinduja Hospital, and she then joined faculty at Tata Memorial Hospital. Speakers, over to you.
Yes, Dr. Hitesh.
Yeah, thank you very much for the warm welcome, Javita ji, and I accept your query and invitation that we should also discuss about the tobacco in the next, maybe Jasim will take that forward. But to just give you a glimpse on how tobacco is horrendous, it impacts your life, I will have some part of my presentation dedicated to simply tobacco, because we actually are my mentor, Dr. Pankaj Chaturvedi, is one of the crusaders of anti-tobacco campaign. So that reflects on my presentation and my way of living against cancer as well. And since it is dedicated to women today, I will give you information also on how head and neck cancers are mostly for males, yes, but it is also for females in a different way. I'll let you know, and also give you the information on how it affects female differently. Okay, so let me start. Okay, host, can you help me enabling the participant screen sharing? Pramod, can you help me in that?
Yes, sir. Just a minute.
Yeah. So by the time today is actually a World Cancer Day. So World Cancer Day was actually dedicated on February 4th in year 2000 in France, Paris. And this day we make sure we do such campaigns for especially for prevention and awareness of cancers like oral cavity cancers, which is highest in
Yes,
India.
can you try now?
Sorry, what? Hello?
Can you try screen sharing now?
Yeah, yes, I am able to do it.
Sankita, could you share the YouTube link also on the chat box?
Ma'am, it's already shared, ma'am.
Okay.
In the chat box, I already posted the YouTube link.
Yeah, so I think everyone can see my screen now.
Yes, sir.
Yeah, sir.
Yes, sir.
So today is World Cancer Day, 4th February. I am Dr. Hitesh Singhvi, as already been introduced, head and neck oncosurgeon. That is the reason why I'll concentrate only on head and neck cancers. If you see the background of the screen, it is actually a tobacco shop, which I want you to get into, get very aware of it, that these shops you should be targeting and not be going there. World Cancer Day was established on 4th February 2000 at the World Cancer Summit Against Cancer for the New Millennium, which was held in Paris. So there are various themes every year. UICC, it is Union of International Cancer Care. It gives you a theme which you can follow right from 2010 when it started to 2021. Last year it was I am and I will, and this time it is Close the Gap Care. Now, what do you mean by Close the Gap Care is it aims to raise the awareness about the vast difference in cancer care and prevention that people from different sections of society can avail. People with low income risk, low income, lack of educational qualification, disabilities face considerable barriers in availing care for cancer. So according to recent stats, the 5-year survival rate for cancer is 71% for white women and 58% for Black women. So in United States, the low socioeconomic background is mostly from a darker race. And you can see the significant difference in their survival because the access, the facility which they get is far more inferior than the fairer race. As per reports, more than 90% of the cervical cancer mortality occurs in low and middle income countries. So again, the gap is huge between the low and high socioeconomic status, and that is the reason why this year's theme is to close the gap, to bridge, to build bridges. Now, India is called Global Oral Cancer Capital. Why it is so? Because we have more than 2 lakh new oral cancer cases arising every year. And you know who is responsible for it? Is the same person or the same product which kills 3 million individuals worldwide, which kills 10 million individuals, which will kill 10 million individuals by 2030. It is equivalent to the effects of 10 jumbo crashes every day, about these many tsunamis every year, and it not only kills those many individuals, but also affects those many families. So even if it kills 1 million people, there are 90 million people who are diseased, and 270 million families are distressed. So more than the number of the mortality is also the distress, the numbers, which is very I would say alarming. So the reason is tobacco. So if you see the number of deaths the tsunami brings in once in 10 years, in 20 years, tobacco brings more than that. So there are 42 lakh heart diseases per year, 10 lakh deaths per year, 37 lakh lung diseases per year. So the numbers are huge. And if you see the economic value of it, it is somewhere related to 27,000 crore every year. That is for the world economics. Now let's be specific to Indian scenario. So GATS is a survey which is being done, it is being governed by WHO, but done in many specific countries. So in India, it is Global Adult Tobacco Survey. So here what we see, according to 2015, is second tobacco survey, which was done in India. It says that 21%. So if you see an account, 33% of all the adult Indians. So when I say adult Indians, about 100 crore individuals, out of them, 33% they consume tobacco. That is huge. That is 1/3 of all the adults, they consume tobacco in some form. It can be smokeless tobacco, it can be smoking combustible. Now the fashion is of e-cigarettes. But what is more alarming for me is 21% of that. That means about out of 33%, 21% they consume smokeless tobacco. Whatever rules we have in India, like smoke-free zone and etc., 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 those are copied from Western world. In Western world, we have more of smoking, but in India or in Indian subcontinent, we see more of smokeless tobacco being used. So that is the reason why it's very important that our population, especially young generations who are studying in schools and colleges, they must be aware that smokeless tobacco, that means like gutka, kheni, jarda, they are as harmful as smoking, or sometimes more than that. Okay, and why I'm being so stressful on it, because it is our problem. It's our Indian problem that we consume pan, we consume tobacco. Maybe in last 2 to 3 days, I've come across an article which says we spend about 300 to 400 crore just in cleaning the pan stains over railways and over roads and etc. That is a small portion of the problems which we face because of tobacco, and especially smokeless tobacco. So to just quote the numbers, that's 270 million, that is 27 crore individuals. This data is of 2020. Now it has become more. So 27 crore adult Indians, they consume tobacco, and 1.16 crore are because of smokeless tobacco. And to give you a brief idea on how it affects, is tobacco kills every third user prematurely. So smoke-free campaign may not be the best way in India. It is a smokeless tobacco, or at least tobacco-free zones. Colleges and schools should be tobacco-free. They are the best way to go ahead for to prevent any kind of oral cancers. Now, if you see, tobacco has 30 plus carcinogens. And when I say carcinogens, each carcinogen has an independent capacity to produce cancer. That means tobacco can create 30 to 70 different kind of cancers in body. And we have this, the media always tells you that Pepsi is very dangerous and etc., etc. It will never tell you that cigarette has so many types of different poisonous substances, like carbon monoxide, which is exhaust in fumes. It has cadmium, which is used in batteries. It has nicotine, which makes you dependent, which makes you so dependent on consuming tobacco on everyday basis. It has naphthalene, methanol, acetol, all kind of poisonous substances which you see in different kind of industry solvents, lethal poisons, and etc. So that this picture you already know, but what you don't know is this picture, that we use even areca nut, like supari, like kheni, like your gutka. All these things are as dangerous as smoking or smoked tobacco. So maybe in 2010, what tobacco industry did was, it tried to give a surrogate or a safe surrogate for smoking. What they said was, use gutka, it is less dangerous than smoking. But with data coming in last 5 years, in last 10 years, it is said that gutka is more dangerous than a chuta tobacco. So what we have seen a shift and drift of oral cavity cancers being happening in young individuals. So maybe 2 decades back, the incidence or the age in which the oral cancer used to happen was between 50 to 60 years. Now it is 40 to 50 years. So we have taken a drift of 10 years more in young individuals. So when you say more in young individuals, that means it is hampering our productive life. That means it is hampering our economics. And India has the highest incidence of oral cancer. 1 lakh new oral cavity cancer arise every year and is commonest cancer in Indian men. And 50% of those cancer, they die in first year. We need to understand this, that 70 to 80% of all the oral cancer which we see, especially in the data comes from Tata Memorial Hospital, is one of the premium institutes in India, that 70 to 80% of all the cancer, or all the oral cavity cancer which we see are advanced cancer. So when we say advanced cancer, even if you treat them, they will not survive for more than 2 to 3 years or 5 years. So that is the reason why one of the key points which I want to highlight today is we need to catch them early. Early detection is key. So if you see these cases, these are very advanced cancer cases, photograph of our patients which we have treated in TMH and also otherwise outside. So some have lived even today and some have not. So what is the difference between them? Difference between them was majorly those who have lived, we have got them very early, stage 1 and stage 2 stages, and they live still now with a good quality of life. So another message which I want to pass is, even if your relative or some acquaintance suffers from oral cancer, and if it is an early stage, they can still live a normal life with good quality. So quality of life will also be there if it is detected early and if it is treated to complete extent. Now, again, coming to tobacco, why it is so popular? Of course, during young age, like your age, between 18 to 25, between 18 and 25 or 16 and 25 is the adolescent age where just people want to try everything. So it's a peer pressure which kicks you towards this addiction. Second, if you see a smoker's selfie, this is the comic photograph which we have taken, in which we have seen that if you smoke tobacco, you will not have any muscle or skin over you. You will be lying as a skeleton in some graveyard. Second is addictiveness. That means it is said that nicotine, which is the content of tobacco, is as addictive as cocaine. So once you consume this kind of a product, it makes you consume more and more on everyday basis. Second is why it is so popular, because people think or organizations think that they generate income and there are very few losses, but it is not so, because some people say there are tobacco farmers who will suffer if you stop making tobacco crop, but it is not so. The number of people who are dying are far more than people who are getting affected. So even economics cannot give you a reason why we should still manufacture tobacco. Sometimes it is our problem. Sometimes it's problem of doctors who are not able to check the oral cavity well, not able to explain to the patient that how tobacco is a problem. Of course, patient comes with some other problems like cough or fever, but even then, if doctors take 30 to 40 seconds extra to see that whether he's consuming tobacco or not, and if he advises that patient, then chances of its quit rate increases by 50%. So yes, it's also a responsibility of us as a doctors to understand that we as Indians are suffering from a cancer which is preventable, which we can prevent. Yeah. So it is our ignorance, sometimes ignorance of doctors, which leads to 10 times higher chances of cancer of throat, 50 times higher chances of mouth cancer, and 12 times higher chances of lung cancer. So we should not be silent. So it is my advice even to our fellow doctors and physicians and dentists, they should not be silent. Talk to your patient about problems you will face because of tobacco. Fifth is forceful advertising, like Rokshri Pan Masala, like bad lifestyle, it'll kill you, like Chini Chini. So all these we have tried to make it a little comic, so you'll understand what exactly they have an impact on you. So what are the myths? Is lesser consumption is safer. It's a personal choice. It is a stress reliever. People live long despite tobacco usage. Everyone has to die someday. But these are only myths. When actually tobacco crops on you, when cancer crops on you, it literally shatters you with your family life. It consumes all your savings. So it's better we prevent this. Now, why tobacco it's a health issue? Yes, it's a health issue. It's a political issue, and health is a subject of state government. It's important that we ban tobacco, but immediately banning tobacco is not still a cup of tea for any government organization. We have still come to the extent where we have banned gutka, especially in states like Maharashtra and Bihar, but we are still not been able to ban tobacco. So if you see from if you see all these bans, so when I say government has been inclusive in banning these, yes. So from 2013 and onwards, we have seen many states taken over where all these flavored products like tobacco, gutka, pan masala have been banned. So the best way to educate, best way to prevent oral cancer is by knowing the ill effects of tobacco and by knowing how you can prevent it. So if we can make a statement, or if we can push people of not consuming tobacco, then definitely we will be able to prevent 85% of all the head and neck cancers. That is, we will be able to prevent 1 lakh deaths every year. That is huge. So to conclude, physicians can be powerful role models in tobacco control efforts. They can be effective advocates, and they should be at the forefront to control tobacco efforts. So quit tobacco and win life. Today, on the occasion of World Cancer Day, let us join the war to defeat cancer by avoiding tobacco. Let us start a tobacco-free campaign. And a few things which I want to especially speak for women, especially in oral cancer, is there are many patients which we come across in our OPD where they do not consume tobacco, where they do not consume alcohol. They are especially females suffering from tongue cancer. And what is the reason towards this? Is it can be, of course, neglect, because women tend to neglect, women tend to tolerate all the pain sign symptoms more. Also, there are chances that these women will have a sharp tooth or ill-framed dentures associated with it, or sometimes it may be because of HPV viruses, human papilloma virus. Definitely, there is no evidence to say that, but in our OPD, this is a general finding that we have seen. If you count 100 patients in whom those who do not consume tobacco, then 60 to 70% will be females. So it is very important for us to understand that even if you are not habituals, even if you don't consume tobacco, you have ill-fitting dentures in your mouth, you have sharp tooth in your mouth, which is continuously hitting your mucosa, then there are chances that you might develop non-healing ulcers. And if you're developing non-healing ulcers, and any ulcer which is in your mouth for more than 3 weeks, you should always consult an onco physician to understand that whether that cancer is harmful to you or not. So with this, I end my presentation. I would like to take any questions which our audiences have for me.
Doctor, we will be keeping the question answer session in the end. Is it okay?
That's great. No issues.
Okay, okay, sir. Can we request Dr. Uma? 40 minutes.
Hi, can you see my slides?
Yes, ma'am.
All right.
Yes, madam.
Yes, we can see you and your slide as well.
Okay, just a moment till I adjust the controls. Just 2 minutes. So I would like to thank the for this very important program, that is the cancer awareness program today. And it's like Hitesh has already discussed about 4th February being the, can you hear me?
Yes, ma'am.
Yes.
Yes, madam.
All right. I mean, Hitesh has already discussed regarding the 4th February being celebrated as World Cancer Day, with the aim of, creating awareness about this deadly disease all across the world. Every 3 years, they come up with a new theme. And this year's theme is mainly Close the Care Gap, which basically means that we want to try and establish equality for the treatment, for the awareness, and for education about this deadly disease. So I'm going to focus on mainly women-related cancers. Hitesh has already spoken about tobacco and cancer. He's given a few statistics. So we know that cancer is causing about 12% of all deaths. Even in India, about 1.5 to 2 million cancer cases occur at any point in time. Every year, about 8 lakh new cases are detected in India. Every year, 5.5 lakh cancer patients will die in our country. And why is this? Why is it such a deadly disease? Mainly because most patients will come to us at a very advanced stage. So almost 70 to 80%, although I must say that these numbers are decreasing in more recent times. And we find that they come to us at a very late stage. And with that, this time the treatment is, I would say more intention is palliative rather than a curative form of treatment. So that is why we need to try and detect cancers early. Because we can cure at an early stage, the treatment can be abbreviated to some extent. It causes less financial burden. Advanced disease, again, the results are poorer on treatment. Patients require repeated chemotherapy, repeated visits to the hospital, leads to a lot of financial, psychological burden. So it is very important to detect this cancer very early. How do I do this? How do we do this? We have to create awareness amongst the women for cancer. We have to improve the diagnosis of cancer so that we can get it at an early stage. So let's talk about cancer in women. Breast cancer, even in India and globally, is the leading cause of cancer in women currently. In India, until a few years ago, a decade ago maybe, it used to be cervical cancer, but now the breast cancer has taken over, and cervix is a close second to breast cancer. And we'll discuss in brief about both of these. So coming to breast cancer is the most common form of cancer amongst women, and it is almost the second common cause of cancer-related mortality, because 1 out of 8 women will be detected with cancer. That's how much the incidence of breast cancer is. And 1/3 of women with breast cancer will die from the disease, mainly because they come at very advanced stage. Before we talk about breast cancer, let's understand a little bit about female breast anatomy. What is the breast? Breast is responsible for secreting the milk or the lactation that happens after the baby is born. So it mainly consists of certain ducts and lobules which secrete the milk, and ducts which carry the milk, and a lot of fat tissue which is interspersed with some connective tissue. What are the risk factors that cause breast cancer? So, not every woman gets breast cancer. It's 1 out of 8. So there are certain risk factors which may predispose a woman to cancer. So what are they? There are certain factors which are not preventable, in the sense that we are born with them. Our age, our gender, being a woman itself puts us at risk for developing breast cancer. Aging, as the age advances, the risk for breast cancer goes up. There are certain genetic risk factors. Genetic risk factors as in are the genes that we've inherited from our parents, our grandparents. Especially if you have a strong family history of breast cancer or ovarian cancer, then yes, there may be something genetic which may lead to the increased risk of breast cancer in me. Certain factors like menstruation, exposure to estrogen, these may not be entirely in our control. There are certain risk factors which we definitely can control, and the most important ones that I would like to highlight here is obesity and physical inactivity, because these are the two factors which are easily modifiable by just simply changing our lifestyle, being more physically active. We know that now, nowadays everybody has a desk job. Many of us have a desk job. And in these COVID times with the lockdowns happening, it has been very difficult to stay physically active. But physical inactivity and obesity both have been shown in clinical trials to be adverse risk factors for increasing the risk of breast cancer. Additional risk factors like hormone replacement therapy or oral contraception or increased exposure to estrogen can also lead to an increased risk of breast cancer. What are the signs and symptoms? So when should you meet the doctor? It is very important you should know all these things, so that if you find the slightest symptom, if you rush to the doctor, then definitely the cancer can be detected early. So the most common symptom that we see is a lump or a thickening or a swelling in the breast or the armpit. Now, many times what happens is, that women, because the lump starts off as painless. So the cancer lump is usually, it does not have any pain. It just is there. So because it does not give you pain, you tend to neglect it. You think that, oh, it's just something and, it will go away or something like that. So if it's a lump, if it is a painless lump especially, then it is an alarming sign and one must consult a doctor. One must undergo tests or, at least a mammography or a sonography just to check what kind of lump it is, and depending upon that, decide whether additional tests need to be done. In addition, lump is not the only symptom. You can have any discharge, especially bleeding from the nipple. Then this may be a sign of cancer. Change in any size or the contour or of breast. Any nipple areolar changes like any inversion of nipple, cracking of nipples, or a change in color of nipples. In very advanced stages, sometimes what happens is the breast, the skin over the breast also gets involved. And this leads to a peau d'orange or a what you call as a appearance of an orange skin. If you all seen as orange and how the skin of the orange feels, that's how the breast skin feels in very, very advanced stages. So how do I detect early? I know the signs and symptoms. I know the risk factors now. So how do I detect early? Most important is a monthly self-breast examination. So that is one way to, we'll discuss about all these points in detail. Monthly self-breast examination, a clinical examination by a trained nurse or a physician, imaging, like tests like mammography or ultrasound, or in very high-risk patients, we also recommend MRI of the breast. So what is breast self-examination? Breast self-examination is very, very important. In fact, we advise to start it as early as the age of 20 years. It is important because it makes a woman familiar with the breasts, and you can change, if you know how it is, then you can detect the changes also very, very early. You have to examine the breast and the underarm area, and this is how you do it. This is just a pictorial image of how to do it. You can examine yourself in the shower. When you're going for a bath, you can just stand in front of the mirror with, with both the hands at the sides and then both the hands at the hips and both the hands up. So with these, in this way, you can see if there are any changes in the shape or contour of the breast. Then you have to stand and examine or palpate the breast in circular motion all the way from the collarbone till the under surface and including the armpit area as well. So when you examine, you have to use the flat of the hand, not the tips of the fingers. If you use the tips of the fingers, the whole breast will feel very lumpy. You have to use this part of your fingers to check your breast. You can do that again in lying down, and at the end, squeeze the nipples to see if there's any discharge coming out from that. So this completes your breast self-examination. It takes about 15 to 20 minutes. You don't have to do it every day. It is just once a month. When to do it? In women who have their periods regularly, it is best to do it about 5 to 7 days after the beginning of the period. Mainly because, many times before the period begins, you feel the breasts are congested, or there may be tenderness, or there may be pain. So this will not allow you to examine the breast properly. So it's best to do it 5 to 7 days after the beginning of the period. In menopausal women or even in pregnant women, who don't have periods, they can do it any date of the month. They can decide. Like I said, it takes about 20 minutes, and once a month is the frequency at which you should be doing it. Now, clinical examination is performed by a doctor or a nurse. After 40, maybe once a year when you go for your regular health check, that's when you should do it. If you are between the ages of 20 and 40, you may do it once in every 3 years for women. And if you are at high risk, like we discussed about the risk factors, so sometimes women who are genetically predisposed or they have certain high risk genetic mutations, in these patients, we recommend a more frequent examination to try and detect lumps early. A little bit about what are the investigations that we do. Mammography. We have all, when you talk about breast cancer, you can't forget mammography, something which is a part and parcel of breast cancer treatment, screening, and diagnosis. So what is mammography? Mammography is nothing but an X-ray of the breast. Many of you who are employed would have gotten a pre-employment health check. And in this, they do often an X-ray of the chest. Now, X-ray of the chest is completely different from X-ray of the breast. So basically what happens is the breast is squeezed between two panels. It's a little discomforting, but only for a few seconds. And the X-ray is shot to give an image like this. When should you do it? Whenever your doctor recommends. If there is a lump or if there is any abnormality felt, we would recommend you to do a mammography. But we recommend mammography only over the age of 40. In younger women, we would suggest to do an ultrasound or an MRI, mainly because in women who have dense breasts, the mammography may not pick up all the lesions. And in younger women, we don't want them exposed to the X-ray, which is used to take a mammogram. The other imaging modalities, I'm sorry about this. The other imaging modalities include ultrasound. What is the advantage? Usually the ultrasound and the X-ray mammography are complementary in the sense that they are both done together. If there is a lump found, the ultrasound can help us tell us whether it is a cyst, whether it is solid, if it is a simple cyst, you can just aspirate it and it collapses. So these are the things that we can additionally find out from the ultrasound. MRI is important in certain women who are at high risk for breast cancer. It is not for everybody. You can't just walk in and say, I want to do an MRI of the breast. It is mainly in very dense breasts, we can get where the mammography may not allow us to detect small lesions. There it is helpful in women who are at high risk, because in these women, we have to start the screening at a very early age. In these women also, we can do an MRI. But yes, it has a lot of false positives. False positives mean that you end up finding a lot of noise, which if you chase, comes up with nothing. So it requires a lot of technical expertise. MRI requires a special coil to do the breast MRI. It requires a special training to read the MRI of the breast, to get the accurate diagnosis. So once a lump is found, so what do you do then? Just even if it is suspicious or highly suspicious, we do need additional tests because we need to confirm that what we are dealing with is cancer. In such situations, what we do is we have to remove certain tissue from that particular lump and send it for testing, as in pathology or to the lab, to make sure what we are dealing with is breast cancer. Because even in breast lumps, you may have not all breast cancers are not all breast lumps are cancerous, firstly. And secondly, even the types of breast cancers may be different. Some may have ductal carcinoma, some may have phyllodes tumor, some may have lymphoma. So there are a lot of variety that you can get even in breast lumps. So it is very important to know what you are dealing with before you plan the treatment. For this reason, we need to do a tissue sampling, which can be done in two ways. One is an FNAC or a cytology. So what it does is it is like a blood test. If any of you have gone for a blood test, you know the size of the needle. So just a few cells are aspirated from that particular lump, put on the slide, and it is seen under the microscope, and they tell you whether it is cancerous or not. Advantages is that it's a very simple procedure. It can be, it gives me the result in a day or two. But the disadvantage is that it's a very user-dependent procedure. So, it has to have a technical expertise to be able to remove the hit the exact site and remove the cells correctly. And even if it is clinically very suspicious, and if it is negative, if it is positive, I know it is positive, but if it is negative, it may not always be the correct result. So what we do here nowadays in breast lumps is mainly biopsy. Biopsy it uses a little fatter needle, and we remove a part of the tissue or a part of the lump and send it for testing. The advantage is that I'm more confident of what has been, if it is reported as positive or negative. Also, if it is positive, I can do additional tests. Now, like I was talking about, that breast cancer is not just one illness, you can have different lumps. Even if it is a cancer, it can be, the treatment of that particular cancer depends upon the type of cancer it is. So even in breast cancer, whether it is hormone positive, whether it is, whether I can give hormone treatment, whether it is negative for all the markers, whether there are certain markers which help me, add a targeted drug or immunotherapy. All these things I decide based on these additional tests on the tumor, on the biopsy. This also helps me decide whether I need to give chemo, I don't need to give chemo, whether I need to give chemo first, whether the patient goes for surgery first. All these things can be decided by doing these tests on the biopsy. So biopsy is the usual way to go once we find a lump in the breast, which is very suspicious. So what are the treatment we have right now for breast cancer? Surgery, radiation, and then we have systemic therapy. A little bit about each. Surgery, women, when we talk about surgery for breast cancer, women are scared. Now we feel that it's going to be the whole breast has to be removed and it has to go. Now that's how the treatment is going to be. But that's not true anymore. The results of conserving the breast as well as doing a mastectomy are the same. But the caveat to that is, if you find the breast cancer at an early stage, we can definitely try and conserve the breast. And we don't even have to remove the entire lymph nodes now from the armpit as we used to. We just try to find the lymph nodes which are positive and try and test them. So this is the way we can do. So cosmetic appearance does not change. Even in case if a mastectomy is required or, the entire breast has to be removed, there are a lot of options of reconstruction, a lot of options of, implants, which do not really alter the cosmetic appearance of the woman. So she feels, the appearance is, because it is very important to have a good cosmetic appearance for not just your, it's important for your mental health as well. You feel good about yourself. So those are the advantages or advances in our surgery. So you don't have to be scared that if there is breast cancer, I need to get the whole breast removed. If you do a breast conserving surgery, however, you need to go for additional radiation therapy. That is a must. Also, radiation therapy is recommended if the disease is advanced in an advanced stage. In systemic therapy, we have many options. Again, I will say that, if the patient has a hormone positive tumor, it's a very tiny tumor, I don't have to give chemo in all patients. I can just give hormone therapy. So it is very important. Again and again, we say the same thing. It is important that you detect it early. You go to the doctor early. It is very, very important. So the options we have is chemo, hormone therapy in certain patients, biologic therapy, like we talked about, targeted therapy, immunotherapy. These are the certain drugs that we can offer now to patients for breast cancer. Any questions on, or we are taking the questions at the end, right? Or any questions? Any questions for breast cancer?
No, ma'am.
No, ma'am.
So we'll talk a little bit about cervical cancer because this is the second most common cause of cancer.
Just one second, Vijay Kulkarni here. I have a question on breast cancer.
Yes, sir.
You can hear me? Am I audible?
Yeah, I can hear you.
Yeah, unfortunately, my mother died of breast cancer when she was 45. It was detected.
Okay.
And she died at the age of 49. And she was also a primary school teacher. Okay. And initial diagnosing was not done properly. And what are the precautions? Because as you know, the teacher generally use the chalkboard and they have to raise their hand and write on the board.
Yeah.
So when she was getting a pain below the arm, as you rightly explained, that was ignored because in the initial phase, you tolerate the pain.
Yeah.
It is bearable. And then generally what you do, you go to an MBBS doctor who will ask you to apply either a Mu or a Volini or whatever. So unfortunately, initial diagnosing was not done properly. And by the time she came to Mumbai from Karnataka, you must be knowing Dr. Parolikar, who's in Maharashtra, is a very senior doctor. I mean, I consulted nearly 26 doctors. So I can correlate whatever you are telling. All this is absolutely perfect. Now, can you advise our teachers precautions? What are the things which we should never ignore at the initial stage?
Yeah. So like I said, that in the signs and symptoms, if you feel any abnormality, if you feel any kind of discomfort, if you feel that there is any lump or, there is a swelling, if you have even the slightest doubt, you should get yourself checked by a physician, who is a trained person. Sometimes, you may miss small lumps, which we will be able to detect because our exam, we are trained to do the examination. You're doing it like, there's a slight difference between the way we check and how you check. Yes. So in case if you feel any abnormality, if you have any doubt, you must go for go to your clinician. And women over the age of 40, 45, I would recommend you should at least have an annual health check, and you should try to do mammography, especially once in a year or once in 2 years, to try and detect lumps early.
No, but how to deal with this mental hazard or a barrier? Like if you go for consultation, if something is detected, oh, I will be facing. So that is somewhere the consulting physician and also advisors like you should play a role.
Yes,
because
definitely. So definitely, it is not. It is that is why we have to have more awareness programs. What happens is women in India tend to put the family first always. So yes, they never take care of themselves. Yes. They are always trying to now is it's exams for kids, or the in-laws are here, or somebody's not well or something or the other is happening. So they try to they always take a back seat when their health comes. So it is very important that they don't do that, because, and as husbands and as children, you must make sure that your wives and your mothers and your sisters or your aunts, whatever, they should be taken care of. If they have any symptom, yes, you have to take part in, managing them, and you should explain to them that, they are also very important, because if they are not healthy, how are they going to take care of the family?
Yes.
So those are the things that are very important. So as a family, you should be also encouraging the women in your family to go forth for health checks and to test themselves, and if they have any problem, consult a doctor immediately.
Because the cancer kills the patient and also her family. Because in our case,
it is not just it is the person who is suffering, yes, but even the family goes through a lot of turmoil during this time, during the treatment, during the diagnosis, everything.
Yes, yes. So I think as a institution, we should have some policy wherein in charge principal madam should push this agenda. It's like a staying fit. It's not like you are not inviting cancer by merely going for some tests. So yes. I think as a trust, if we have to do something, we will be definitely happy to join hands. Thank you, ma'am. It's a great initiative. Thank you.
Thank you, Vijay sir. Dr. Uma,
yeah.
Actually, we had kept these question answer sessions in the end.
Oh, I'm sorry.
Breast cancer. No, of course, sir had shared this incident with me also earlier. So we are aware of this, the women having so many inhibitions. And, when you finish with your the cervical cancer part, I would also like to have some questions, because I am also personally, my mother had surgery yesterday, removal of uterus, and the kind of pain that she was going through last evening, I could not bear it. So, I will share my experience also.
Certainly.
So we'll finish with this. And sir, we will take your points that the yearly checkups are a must, sir.
Yep.
Okay, ma'am.
Okay. So coming to cervical cancer. What is cervical cancer? It is the cancer of a female reproductive tract. So we know that, women have the uterus which bears the child, or which harbors the child during pregnancy. The mouth of the uterus is what is the cervix, what we call, and that the cancer affecting this area is called the cervical cancer. And this is one cancer, I think, which should not be seen in advanced stages at all, because it's the it's the easiest cancer, I would say. It's for screening, or it is for early detection, because it is just a simple pap smear that you need to do once in 3 years or once in 5 years, and see, you can even catch it at a precancerous lesion, and you can get it out early. So you don't need to have this even develop a cervical cancer, because you can detect it at a stage when the cancer has not fully developed. So this is what I was talking about. This is our female reproductive tract. We have the uterus, the ovaries, and this mouth of the uterus is called what is called as the cervix. And this is the cancer affecting this part is what is called as cervical cancer. So what is the cause of cervical cancer? We read about, breast cancer, the risk factors. The central cause for cervical cancer is nothing but a virus called human papilloma virus, or HPV. How is it transmitted? It is transmitted through sexual contact. Yeah, whatever is detected today, you could have acquired it years ago. Now, there are different types of HPV. Now, in this corona times, I think we are so well versed with the viruses, and we know that there are multiple strains. Every day we hear of a new strain that is coming up in the virus. Similarly, in HPV also, or human papilloma virus also, we have multiple strains, and not all strains can cause cervical cancer. Some cause only warts or something like that. They're called low risk. There are high risk, which will cause precancerous or cancer of the cervix. And it is not like you will have symptoms like, when you get a viral flu, or you have a body ache, you have some fever. So even infection with HPV will not give rise to these symptoms. So you will not even understand that you've been infected with the HPV virus. How common? Very common. Most men and women who've ever had sexual intercourse will have been exposed to this virus. And more than 75% of active women have been exposed to HPV by the age of 18 to 22. What are the risk factors? Obviously, risk factors, women who've ever had sex or who have more than one partner, women whose partner has had more than one sexual partner, again, are at risk for developing cervical cancer. Having sexually transmitted diseases also, like even HIV, is a risk factor for developing breast cancer. With immune, like I was talking about HIV, in women who have a low immunity, which may be because of chronic steroid use for some other illness, or who are post-transplant, those who have undergone an organ transplant and are on immunosuppression, those who are undergoing active chemotherapy also because of low immunity, this HPV virus can reactivate and lead to cervical cancer. Smoking, we all talked about tobacco before this, and smoking is also causes an increased risk for cervical cancer. So how can you take precautions? Obviously, you should know who your sexual partner is. Try to be with one person only. Avoid smoking, healthy diet and lifestyle, use of barrier contraceptives. Because of reduced transmission or reduced risk of transmission of HPV, you can reduce your risk for developing cervical cancer. Most important, get your pap smear testing done and or HPV testing done, because that can detect it at a very early stage, which will just reduce, which will even at a precancerous stage, so even before the cancer is actually started to form, you can detect it and get yourself treated for the same. So what is a pap smear test? We all talk about it when it comes to cervical cancer. It's a very simple test. It's a little discomforting. Obviously, it's an internal examination by a trained gynecologist. What we do is we collect some cells from the surface of the cervix and look for any abnormal cells, like how we did the FNAC from the breast lump. Similarly, we just collect, so it's not with a needle, it's just with a cotton swab, and we put it on the smear and on the slide, and we see the test. Here we can detect any abnormal cells. There may be different findings. Some abnormal cells can be overlooked, some are suspicious, in which case we ask for additional tests, which I will talk about. This is if you find something abnormal on the pap smear, what we do is the colposcopy. Colposcopy mainly means is that we apply something like vinegar or acetic acid on the cervix, and we use a magnifying instrument to see. So here, if you don't see anything lump, you don't find a lump or a growth, this detects any kind of abnormality. So we can take a very good biopsy from the abnormal area to confirm whether there is any cancer or not. So when should you schedule your pap smear? Obviously, when you should not be having your periods, it is best to abstain from any sexual activity or avoid tampons, douches, at least for 2 to 3 days before your pap smear, because it will interfere with the test. You should start screening by the age of 30, every 3 years. And you can stop at the age of 65 or 70 if your last 3 tests have been negative and there have been no abnormal results in the last 10 years. You can easily stop it after the age of 70. What is an HPV test? So there is something called as a pap smear and there is something called as a HPV test. Now, when there is a human HPV test, basically means that you collect the cells from around the cervix. It's like a liquid or, you wash it and you take the cells from the cervix and you send it for a HPV test. Now, HPV test will try to look at whether there is any viral infection in the cervix. And if it is negative, then you may want to, you can even do your pap smear after 5 or 6 years from the first test. They are collected just like the pap test and it will look at the presence of any virus. It will tell us what strain of virus you have to decide whether you need, how soon you need the additional test. So we discussed about biopsy. So what is the treatment? Treatment is surgery in early stages, in locally advanced stages, chemotherapy and radiation in combination. In very advanced stages or in metastatic disease, the only treatment option remains palliative chemotherapy. So the whole aim of today's talk or today's awareness campaign is to try and prevention. Actually, more than prevention, it is to catch it early. One cannot prevent cancer, see, because as humans, we are going to grow. Our age is one factor. Like, there are certain factors which we can't modify. So we can try and reduce definitely our risk of developing cancer. Try to reach your doctor early. If there is any lump or any abnormal changes in the breast, try to reach the doctor so they can test you and find out whether you have early stage breast cancer, which can be easily cured in 9 out of 10 women. Any abnormal bleeding or discharge from the vagina, these can be early signs and symptoms of cervical cancer. It is important to control weight, put your blood pressure, diabetes in check. Physical activity, try to at least have some form of physical activity, 45-minute walk, 30-minute walk, at least once a day. Avoid harmful habits like smoking, excessive alcohol, and try to get yourself screened regularly so that you can have a healthy life. Thank you so much for your patient listening. I'll be happy to take questions now.
If anyone have any query or want to ask something, can put it in the chat box or you can unmute yourself.
I request teachers to ask questions.
Are there questions in the chat box? Should I see?
Sir has posted one question here. Ma'am, there's a question posted.
Yeah, whether insurance coverage is there.
Yeah.
So, so we do have patients who get insurance coverage for breast cancer, but it's very important that you read your policy because, many times they will say does not cover critical illness or does not cover, certain things. So it's very important that you read what kind of policy that you have. And it's important that, everybody should have a health policy because the treatment for cancer can, it's very expensive. And it's really, it is a real financial burden on people who don't have a policy.
I think there's a question for me. If anybody wants to quit tobacco, what should by Aparna? So if anybody wants to quit tobacco, there are 2 ways in which we can help them. One is pharmacogenic. That means we can give them medications. And second is non-pharmacogenic. Non-pharmacogenic is like behavior counseling. First, we need to understand why the person is consuming tobacco, what has led to it. Because some people use tobacco to suppress their hunger because they want to work for long hours. Some people, some individuals start consuming tobacco because of peer pressure. Some consume tobacco only because they feel they are bored. So first we need to understand what is the cause of their habit, and once we know the cause of the habit, we can definitely do a behavior counseling, and we have some nicotine tablets, nicotine patches, if you want to take in pharmacogenic way.
Thank you, Dr. Hitesh. As we discussed earlier also, we would like to have a longer session, or maybe, offline mode will makes a lot of difference. So we would
Definitely, we'll also cover e-cigarettes in that.
Yes, sir. Yeah, of course. Yeah, the trendy ones, okay. And e-cigarettes, hookah, a lot of, the trendy ones. And there are other cigarettes, my nephews keep telling us. So where they keep it and they will not know. Like students can fool anybody, with technology.
Yeah.
Yeah. So we have to tell them. I feel awareness is very important here. So if Fortis Hospital has got some, counseling, sessions, or maybe some mentors can come to our,
There is an idea of forming a tobacco cessation clinic or pre-cancerous clinic, which is still going on.
Yeah.
Definitely will keep you updated. Jasim will keep you updated with that. Dr. Uma is also a part of it.
Okay, that's nice. Dr. Uma, I have a question here, because I realize that women, do not come out and share. Like I would come out with the personal experience that I don't know, they feel मैं तो एक नारी हूँ और मुझे तो सफर करना ही है. तो सफर मीन्स हिंदी का सफर रहे तो ठीक है कि आप घूमो फिरो. सफरिंग वाला सफर हो तो वो गलत है. Women think अरे ये तो मेरे भाग्य में लिखा है, दर्द है. जैसे Kulkarni sir just mentioned, she's a teacher and she is writing on the board. So probably that pain, they are self doctors, all we women, we'll अरे ये दर्द है, इसका ये कारण है, चलो ये गोली खा लेते हैं. But going to a doctor for your personal, checkup, these mental blocks, I feel more than the physical pains, mental block, अरे डॉक्टर के पास जाना है. So how do we, these barricades, how do we come out of these?
So that's a very, very important point actually that you've placed. We, like I mentioned, women always take a back seat, that's like something or the other is in the happening. So, okay, main kal jati hu, you always try to postpone your visit to the doctor. So obviously as a society, I think we all have to change our line of thinking. And together we have to push for I think a lot of things have changed, last over a few, I've been practicing for a long time now. So over the last few years, I am seeing a lot of change in women. They are more forthcoming, younger women in 20s, in 18, they're in their teens also, they get worried and they come to me and they say that I am feeling this problem. So I think the younger generation is probably a little more forthcoming in terms of their symptoms. And like I mentioned, we as a society, even everybody in the house is equally responsible for their own health and their family's health. So that barrier, we still have a little bit of gender gap. So I think the close the gap should also include that gap where, women and men are, are seen equally in terms of not only their health and, in the society per se. So that is how things should be. So I think as teachers, you should really put that in your students and, in their growing age where, they should be understand that men and women are equal. There is no disparity there, physical disparity. Yes, there may be some differences. Yes. But in the eyes of nature, they are the same and both can suffer and both have to build the society together. It's not going to be one is better than the other.
So true, ma'am. Well said. Actually, there's a question by Professor Surabhi Gaur. Ma'am, can you ask the question? Surabhi, ma'am? I think I've seen one question.
Yeah, this is posted that can the excessive consumption of painkillers be the cause of any kind of cancer? This is what my question is. That nowadays, to get rid of the pains, we always consume the painkillers for any kind of pain. So, can it be the cause of the cancer?
So painkillers won't per se cause cancer directly. So if you have pain, it is better to find out why you have the pain instead of just popping painkillers. It may be some tumor, some lump lying there, something happening, which is the cause, or rather than just taking painkillers. But yeah, excessive use of painkillers can damage your kidney. So, there are harmful effects of excessive painkillers. But no, they don't cause cancer per se.
Our IT coordinator,
Uma ma'am.
Ma'am, please.
Yeah.
Uma ma'am, this
Yes.
is Gauri.
Hi.
Yeah, actually, hello ma'am. I was just listening for the about the cervical cancer, which you were informing. So when my daughter was nearly 12 years old, at that time our doctor had told us to have some sort of So I was reluctant actually to have that. So can you just put some light on that? What type of vaccine, or is it really necessary to have and all? So I wanted.
Yes, there's a lot of debate. It still goes on in our conferences to vaccine or to not vaccine for cervical cancer. And I did not touch upon that point to kind of avoid that. But the thing is, see, whatever vaccines are available currently, they only protect against either 2 or 4 viruses. There is one more coming out which is going to protect against 9. So they are not 100% effective. One has to understand that. There is a risk with the vaccine. People have had reactions to the vaccine as well. And it does not stop you, or it should not stop you from undergoing a pap smear every 3 years or every 5 years as it goes. Because it is, like I said, it's not 100%. It protects against the 70 to 80% of the viruses maybe. So it is not a vaccine that is usually recommended for all women. Even if you want to take the vaccine, it has to be before the onset of sexual activity. So many women who already have children have come to me and asked me for a HPV vaccine. That doesn't make sense. So women, the vaccine has to start at an early age, 12 years, maybe 18 years latest. And accordingly, it has to be given the schedule. I don't recollect the schedule right now, but yeah, that you can use it, but it does not stop you from, it should not stop you from undergoing a pap smear.
Thank you, ma'am.
Rajeshri ma'am has a question. I've seen it in the chat box. Rajeshri madam.
Yeah, ma'am.
Yeah, please.
Yeah, doctor, one question I needed to ask was, is there any other treatment apart from chemotherapy for cancer?
So the treatment for cancer can depend upon a lot of things. It is depending upon the type of cancer, what kind of cancer it is, which organ it has affected. So, for example, Dr. Hitesh was talking about tobacco-associated cancer. So many times these cancers, they are just affecting the oral cavity and they're at an early stage. So in this, the surgery is more than enough. You don't need any additional treatment. But if it is something like a lymphoma, or it is something related, where you need to give additional treatment to improve the survival, or in some, like lymphoma, I said, only chemotherapy works. The surgery does not work in that patient. So depending upon what it is, that's how you decide the chemotherapy.
Okay, thank you, doctor.
Dr. Uma, I've been conducting various workshops regarding these, gynae problems with my young girls over the years. I've been heading a women development cell. So many doctors in and around Mulund we have been inviting. When we have these offline sessions, the girls come forward and have so many gynae related questions regarding their menstruation, pre-menstruation. And, we tell them that if they don't want to ask directly, we keep those chits and, they'll put it in a box, and then anonymously you can, I would like you to come once to our institution.
Sure. It would be a pleasure
to have a session like this. Apart from this, I see one question. I think Sharmishta ma'am has put one question. What is the frequency of skin cancer in women? Maybe because many of these fairness lotions and, you know, so many cosmetics that women are using. So many people have these questions regarding whether it's, you know, affects your skin. Maybe it is a little out of this context. Maybe, ma'am, you can throw some light.
So thankfully in India, we don't see too much of skin cancers. You know, it's more in the areas in the Caucasians and in areas where the ozone layer, especially New Zealand and Australia, that's where we see a lot of skin cancers like melanoma. But we do see some, sometimes we can get squamous cell carcinomas and basal cell carcinomas. I mean, Hitesh would also be able to throw some light on that. So it's not very common in Indian women. What I would suggest is always wear a sunscreen when you go out in the sun. That's one way to protect yourself against skin cancer. But because we don't have that white skin like the Caucasians do, so we are kind of partially protected from that.
How Ayurveda can help in this, or maybe diet, or, you know, to save yourself? Is there something, or the diet, you know, the role of diet?
Yes, I'm not an Ayurvedic specialist, so I won't be able to really provide.
Why this question here, ma'am? The people, you know, when they go for these allopathy and then, you know, chemotherapy and all those, so scared, and then all of a sudden they'll stop the treatment. I know personal, you know, friends and relatives where they'll say, no, chemotherapy is this and that, and then they'll drift towards Ayurveda. So maybe, you know, again, my question comes back to the same, the change and, you know, the mental blocks. They'll leave halfway. They'll not go ahead, you know. They'll leave the treatment going on, and then they'll leave it halfway and they'll drift towards something else. And that kind of education, I feel, is required.
So what happens is many times because of chemotherapy is not without side effects. And we all agree that, you know, hair loss is like the most minimal, but there are lots of side effects. And some patients just do not tolerate it very well. So in such situations, we do see that, you know, patients drop out, not just women, men do drop out and try to go for alternative medicine. The whole general premise is that they don't have any side effects. Now, I'm not an Ayurveda specialist or, you know, alternative medicine specialist, but I would not say that they are not without side effects, because we do see side effects after patients who come to us after having taken alternative medicines. You know, they have also come with some liver damage or kidney damage, depending upon what drugs they've been given. So that's probably the reason that they go. And like you rightly said,
I think there's a network issue.
Can you all hear us?
Sorry, I think I got logged off or something. I don't know what happened. It just knocked off. Can you hear me?
Yes.
Nice. So like you rightly said, you know, people, we have to try and talk to the patient and try to understand why they are going to alternative medicines, mainly because they're scared of side effects. But yes, if you talk to the patient and tell them that this is what we can give you, this is the best we can do, and the mindset of the patient has to change. The education has to be there to try and, you know, tell them that, yes, this is the right treatment for you right now. And if you divert, we can't guarantee results in that situation.
Yeah, ma'am, you educated a lot of, you know, the future mothers and, you know, our young girls, sisters, you know, about this.
And I want to educate their
Ma'am,
reach out beyond, then I guess that's something that we can do. You know, if you have to propagate what we've learned today to your peers and to yours, that's how we can.
yes, yes, ma'am. Yes. There's some network issue at your end, ma'am.
I think so. I think so.
Yeah. Any other questions?
There's one more question for Dr. Dangi, I guess.
Yeah.
Can excessive use of contraceptives cause cervical cancer, as they're always showing it to be quite safe?
So excessive use of oral contraceptives, it can lead to actually breast cancer, not so much cervical cancer, breast cancer as well as endometrial CA. But it sometimes is required. So, you know, the risk of breast cancer is maybe twice as much as a normal population, or less than twice as much as a normal population, in case if you're taking oral contraceptive pills. It is, but the hereditary risk is much more. So if there is a good indication for an oral contraceptive pill, for example, in, you know, polycystic ovarian disease, and women who have really irregular periods, who need to normalize that. In such situations, it is okay to take the oral contraceptive pill. It is not a bad thing, or it is not a banned thing. But yes, you should be aware that this is what you have done. And if you have any symptoms, then go to the doctor, or you put yourself in a screening program so that, you know, you can detect the cancer early.
I think we lost her again.
Yeah.
I'm here. Can you see me?
No.
Can you hear me?
Yes.
Okay. I'll start my video, then you can see.
Umu ma'am, Gauri Pai once again here. Just now you answered Sharmishta ma'am's query regarding the skin cancer, in which it was mentioned like that the lotions or the creams which we use maybe that is, but just I was going to the contents of these lotions and all. So they have mentioned that in the contents they have got some mineral oil thing and all which is being used. So mineral oil, actually, when we see or when we hear, it is the byproduct, or it is the waste which comes out. I think the chemistry teachers might be knowing it very well. I am not from that background, but what I know is that this mineral oil which is used in cosmetics is actually, it is a waste product which comes from the petroleum when the extraction is done. Then why still it is being used, and why?
Okay. Can you hear me?
which actually help stop skin cancer. That is my question.
I mean, I'm not a dermatologist, so I'm not very well versed with what contents in the lotions and the oils. But yeah, so some of the byproducts may not be as harmful as we make them out to be. You know, so sometimes we've been using cow dung as gas for so long now. You know, so there are things which, even if they are byproducts, may not always be harmful. And like I said, you have to read what it says. You know, the cigarette pack says smoking can harm you, but people still use it, you know. So you should read what the contents are. And I'm just giving an example.
It's written over there, but in the creams and all, there are the ads which come, and even the certain doctors association they support.
I'm that's a very difficult question to answer. Why they do that, and why do they?
I need to get Dermat on board to answer that.
I am. Dr. Hitesh, I was thinking the same, that the next session.
The problem here is, Kavita madam,
yes, sir.
Our teachers are extremely smart in reframing their questions. Now I am observing, and I am also correlating this with my free legal advice seminars. Now the point is when doctor and advocates are, available, no, now this seminar is getting into a free consultation now. You can see the facial expression of Dr. Hitesh and Dr. Uma. So I don't think they will be able to attend any more seminars now.
No, please don't be in that, because
No, I'm just joking. So the point is, let us restrict to the cancer and don't reframe your question.
Dermatology. No, we would certainly have.
Don't say that whether this causes this cancer.
It is just an opportunity for
your
Kavita ji
other
to
skin related answer, and finally they will say that no, it is not going to cause any cancer. So
No,
smartly
sir.
you are extracting what answer you want for other free medical, what you call consultation. So in any case, as long as they are they are definitely able, but they are in a position to answer, you can definitely ask.
So I'm not a dermatologist. I really won't be able to answer on what contents in the oils and all. But we all use face creams and we all use things, So my thing would be, if it was so harmful, I am sure the Indian FDA would take some steps and the dermatologist association of our country would take some steps to stop it. That's what I would believe. I would have that much faith in my system, I think.
Thank you, ma'am.
I think since offline is also going to start and the auditorium is also getting ready, we should try to start something in our
Sure.
So
I'm going to connect with both the doctors, and we will continue this association. And as sir has rightly pointed out in the chat box, also I've seen that we would go for these health camps, which I feel spreading awareness, because Kulkarni sir, I have personally seen the young girls, when the doctors come and meet the students, my God, the session that last we had for 1 hour, Dr. Hitesh, students really came forward and asked so many questions. So virtual is finally virtual, and when we meet in the physical format, it will make
and apart
Human
from this,
connect is always lacking on virtual platforms.
Yes, sir.
Can you
Apart
excuse
from
me?
this-
I have another talk actually. So can I be excused? I'm sorry. But I have to rush. Another talk at 2
with the
o'clock.
formal vote of
Today is the World
thanks.
Cancer Day, so there are too many talks happening.
We'll just wind up with the vote of thanks.
please go ahead, madam. Kavita, madam, please go ahead.
Some student is ready here.
Yes,
Other, you're going to offer. Otherwise, I will, as a principal and on behalf of Kulkarni sir. Okay. So
Yeah, you can. Please.
Yeah. So on behalf of management of Vidya Prasarak Mandal, my teachers, my vice principal, and all the heads of the institution, I feel so privileged and proud to have such eminent doctors with the vision that I read about Dr. Hitesh and Uma madam. It has been a great pleasure to host you today, and this is just the start, and we would continue to have a longer association with you, sir, and the Fortis Hospital. And at the same time, I should not forget Jashin Khan ji and our own on joint secretary, Vijay Kulkarni sir, who has brought us closer to Fortis Hospital. So thank you once again on behalf of all of us. And
beautiful occasion, and thank you for giving us the opportunity to interact with your students. Of course, it will be great if we can meet them personally and solve their doubts.
Yes.
Just awaiting that association to happen.
Yes, certainly. So on that note,
thank you so much for having us. It is really a pleasure
thank you,
to be
Dr.
here.
Uma. You've been so kind. Thank you so much.
Thank you.
So we'll call it a day then. Thank you.
Ma'am.
Yeah, Kajal wants to do her formal vote of thanks. I will not stop her. Thank you, Kajal Beta. Please.
Yes, ma'am. It gives me an immense pleasure to deliver the vote of thanks for this event to all the dignitaries assembled here. I would like to thank our chief guests who honored this function with their inspirational thoughts. I would like to thank our in-charge principal, Mrs. Kavita Sharma, Vice Principal Anjanika Uday, our program officers, Professor Vijay Lakshmi and Dr. Mangesh Sawant sir, also all the teachers and students and all the NSS volunteers for making this function as a grand success. One present here. Thank you, CWDC convener, Dr. Reshma Anvekar, and ICC convener, Mrs. Anjanika Uday. Thank you, everyone. We have put one link in the chat box. I would like to request everyone to please fill the feedback form.
And last but not the least, Joint Secretary Vijay Kulkarni and all the wonderful audience that we had, okay, and the technical support. Thank you so much. Thank you, Kajal.
Thank you.
We must thank you. Thank you so much.
Thank you.